Yes, hi. Okay, that's what we were trying to get. So did you hear the news reporter from Channel 7 would like you to move over? She knows what looks good on camera, I'm going to guess. So, all right, thank you. And then, are we good to go? Yes, all right. Okay. Well, good morning, everyone. Good morning. Welcome to the City of Riverside. I'm Mayor Patricia Lock-Dawson, and today marks an historic day for the state of California, for Riverside County, our city, and our families. I want to thank everybody that's here today. I've got Supervisor Chuck Washington from the County of Riverside. I've got our presiding judge, Judith Clark, from the County Superior Court. Deborah Mickelson, who's the founder of Project Becky. You will hear a story from her this morning. Dr. Matthew Chang, the Director of Behavioral Health for the Riverside University Health System, and our Mayor Pro Tem, Erin Edwards, from the City of Riverside. She's also the chair of our Housing and Homeless Committee. And I also have with me Council Member Jim Perry, Councilmember Jim Perry, who is the head of our Public Safety Committee for the City of Riverside, and members of the Mayor's Bipartisan Forum, and all supporters for folks that care deeply about this issue in our city. Senator Richard Roth was planning on being with us here today, but he will not be able to make it because he is on jury duty. Why are we here? Why are we here today? Today, the County of Riverside launches Care Court, the first major update to our state's mental health laws since the Lanterman-Petrus Short Act of 1967. Care Court will be a lifeline for families who are seeking help for loved ones suffering from severe mental illness. So what does that mean? It means preventing individuals from becoming homeless while suffering from severe mental illness. It means less people receiving their treatment or services in jail, which are now acting as our de facto mental health services. And it also means less people under conservatorship. But most of all, and what's most important to me, this means hope. Hope for individuals cycling in and out of our justice system with no plan of treatment or advocates to walk with them. Hope for families supporting their loved ones as they suffer from these heartbreaking illnesses. But let me be clear, there's still more work to do. Care Court is not a fix-all solution, but a new tool which puts us in a position to help those who need it most. For too long, we've allowed the status quo of those with severe mental illness to fall into homelessness and languish on our streets without the means to help them. More mental health reforms are on the way this year, including several key pieces of legislation that will support the efforts surrounding Care Court coming online this year. And thank you to Governor Newsom and our state legislators for not accepting the status quo any longer and resolving to try something new for the first time in 50 years. So I want to thank the County of Riverside, the Riverside Superior Court, state agencies, and Judicial Council of California for their support and coordination to ensure the successful implementation of this new program. The leadership of our county supervisors and staff throughout this implementation process has been critical. We're among the first counties to launch Care Court this week. Today marks our first day in the state of California that Care Court will be enacted. So with that, I want to invite Riverside County District 3 Supervisor, who is also the president of the California State Association of Counties, Chuck Washington, to the mic. Supervisor Washington.
Good morning. Thank you, Mayor Lock-Dawson, for hosting this press conference on the launch of the Care Court Act in Riverside County. Local government working together and collaborating has never been as crucial as it is today. As Mayor Locke Dawson said, I'm Chuck Washington, Vice Chair of the Riverside County Board of Supervisors and President of the California State Association of Counties. But more importantly than that, I'm an advocate for caring, holistic approaches to behavioral health services and the mental health needs of our residents. An advocate for the deliberate strides Riverside County has taken through coordinated planning to meet our neighbors wherever they are with the right services at the right time, provided by compassionate experts in the field. As a public servant for over 24 years, I've spoken with countless families who know what it's like to watch loved ones struggle with mental illness and the heartbreaking consequences that follow. Today is for them. The CARE Act, Community Assistance Recovery and Empowerment, is a new state law meant to address the needs of our most vulnerable residents by providing mental health and substance use disorder services to those with a diagnosis of schizophrenia spectrum or other psychotic disorders and who are unlikely to safely survive in the community without supervision. Riverside County is one of 7 pilot counties launching CARE Act services today. And since September 14th of last year, when the legislation was signed into law by Governor Newsom, we've been preparing to bring a new collaborative civil court process to residents that provides personalized treatment plans and community-based support services. By we, I mean the extensive group of stakeholders who are essential to ensuring that individuals receive necessary support and services throughout the entire process. This includes the court system, Riverside University Health System's Behavioral Health Department and medical centers, the county's Department of Housing and Workforce Solutions, our Public Defender's Office, and countywide law enforcement agencies, hospitals, and all of our cities. But even before this, counties up and down the state, including Riverside, were collaborating with the governor's administration to create the CARE Act that we have today. One that begins with select pilot counties before a statewide launch, and one that includes, albeit limited, startup and planning funding. We appreciate this new resource from the governor's administration to assist our most vulnerable residents and look forward to continued partnership with the state to ensure adequate funding to maintain this program and other future innovative tools. And now I'd like to pass the mic to Presiding Judge Judith Clark.
Thank you, Supervisor Washington and Mayor Locke Dawson. I'm Judge Judith Clark, the current presiding judge of the Riverside Superior Court, and the court is proud to be among the Cohort 1 group of courts activating CARE Court today. Implementing legislation that creates an entirely new court program requires a tremendous amount of work. I want to thank the County Executive Office and all of the involved stakeholders for the tremendous effort they have made in working with the court to be ready to implement this program today. I'd especially like to thank those individuals from our court administration who have spent countless hours working both at the state level and with other local agencies to identify, design, and implement all the state and local rules, forms, and procedures that a new court program requires. I'm pleased to announce that the court has already received its first CARE Court petition this morning over the e-submit process, so we are officially underway. We believe that the CARE Court structure that we have designed here in Riverside will help to remove barriers to participation in CARE Court. We have structured Care Court to meet people where they are, both physically and mentally. For those participants who are comfortable in doing so, they can appear in the historic courthouse in downtown Riverside. For those individuals that are reluctant to come into a courtroom environment, or for whom geographic distance might dissuade them from participation, we have designed the program to facilitate their appearance from a variety of behavioral health locations around the county or from anywhere in the county by utilizing our remote platforms. We are hopeful that by structuring the program in this way, we can reach and serve the greatest number of eligible participants, and that this program, much like other collaborative court programs that are operated by the Riverside Superior Court, will allow us, in conjunction with behavioral health and all the other connected agencies, the best opportunity to support this segment of the population that is so in need of our attention. Thank you.
And now I would like to invite Deborah Mickelson to the mic, please, to share her story, founder of Project Becky. Thank you for being here today.
My name is Deborah Mickelson. Through my nonprofit, I started Project Becky in 2020. It is named for my sister who died after several years of struggling with mental illness and living on the streets. My sister became known as the homeless lady, but she was more than a label. She was loved. My husband and I desperately tried to get her into a conservatorship. 10 days after our meeting with the attorney, the conservatorship attorney, Becky took her own life in her tent near a busy intersection. I cannot say for certain if Care Court would have saved my sister's life, but I can say that any extra tool for my family to get their loved ones the help they need is an option I wish we had. Mental health reform, like Care Courts, is desperately needed. This program will give hope to families, to people like my sister, my family, the hope they need for a better tomorrow. Thank you. I'd now like to invite Dr. Matthew Chang, Director of Behavioral Health, Riverside University Health System.
Good morning, everyone, and thank you for joining us today to discuss the Community Assistance, Recovery, and Empowerment, or CARE Act, in Riverside County. At Riverside University Health System, we approach the implementation of Care Court with optimism, recognizing its potential to bring about positive change. However, it is crucial to understand that while the Care Court is a valuable addition to our toolkit, it is not the ultimate solution to all behavioral health challenges. It is tailored to address the needs of a very narrow and specific population. Housing security is a pivotal element of the Care Court program, and we are dedicated to working with our county partners, such as Housing and Workforce Solutions, in providing housing based on individual needs and the availability of suitable housing options. Not everyone who is unhoused will qualify for Care Court, and this program is not a one-size-fits-all solution for the entire housed community. Being unhoused and having behavioral health needs are not mutually exclusive conditions. The Care Court program is designed to address specific needs and circumstances, and while it is a step forward, there are other challenges faced by the unhoused community that need to be addressed. We acknowledge the absence of benchmark data to estimate the reach and impact of the CARE Act. We continue to advocate for more funding for behavioral health services and housing to ensure comprehensive care for this population. We want to emphasize that the importance of seeking voluntary treatment through RUHS. Voluntary treatment remains the most preferred and effective method for addressing mental health challenges. It is crucial for individuals to take proactive steps in managing their mental health, and RUHS is here to support them every step of the way. We urge everyone in need to prioritize their well-being and seek free, quality behavioral health care by calling the RUHS CARES line at 800-499-3008. At RUHS, we are proud to offer a wide variety of services designed to meet a range of behavioral health needs across all levels of care. Our diverse programs and supports ensure the right level of care, promoting well-being and recovery for everyone in our community. RUHS is committed to continued collaboration and innovation to bring high-quality behavioral health care to our community. We will use CareCourt to extend support to those who need it through the extensive services offered by RUHS Behavioral Health. Together, we can make a substantial difference in the lives of our residents. Thank you.
Thank you for your remarks, Dr. Chang. I am Erin Edwards, the Mayor Pro Tem of the City of Riverside. As the Ward 1 Council member, I represent the downtown area and surrounding neighborhoods. I also chair our Council's Housing and Homelessness Committee. I join the voices of optimism today for the good work that can be done through the CareCourt process. I'm greatly encouraged by the cooperation and mutual commitment that I see today from so many spokes on this wheel that will move us forward on the issue to help unhoused people. We know, as we've heard, that CareCourt will not solve homelessness on its own. That task will require many more tools and much more effort, which we are all committed to as well. But CareCourt is a tool that we now have in our toolbox, and I look forward to seeing how it can help move the needle on the issue of homelessness. In the city, we are adding additional tools. Our homelessness action plan was approved by the City Council about a year ago, and its 6 pillars continue to guide our efforts. Our public safety and engagement teams, both in the urban and the wildlands areas, continue to work with people on the streets and in the river bottom. As our new Department of Housing and Human Services in the city, formed just last month, will ensure that we use our resources wisely and most effectively. I want to thank everyone who is here today to make CareCourt a reality. And we'd be very happy to take questions now.
Thank you. Thank you to all our speakers today. I am particularly grateful to the County of Riverside for stepping up. They're taking a great risk here. They're putting forth their own resources, and as partners, this is how we get things done, and Riverside is the best example of that. Riverside City working with Riverside County and our partners. We have a number of people here, technical experts, who are able to answer questions, so I think we have a few moments for questions if we have some from our media partners. Would like to know who would like to answer that. The process for getting a loved one involved in CareCourt.
Let Dr. Chang answer.
Dr. Chang, can you answer that? Would like someone from Dr. Chang's team, perhaps. Hi, come on up and I want to make sure we get the information correct.
Sure. Good morning. The question was, what is the process to get someone into CareCourt? So there's a couple avenues. Our Superior Court here has a self-help legal services group who can help complete forms and complete a petition to petition the court to start the process. Or as our director, Dr. Chang, mentioned, individuals can call behavioral health at the phone number mentioned, the 800-499-3008, and ask for information, and our staff can do pre-screening to help people identify if there's voluntary services that are already available now that the loved one might qualify for, or to help guide through that CareCourt application process. Sure. And I was reminded to introduce myself, so forgive my poor manners. Marcus Cannon, Deputy Director, Behavioral Health. The question was, what are the criteria for CareCourt? Someone needs to be 18 years of age or older. They need to have schizophrenia, spectrum disorder, or another psychotic disorder. They need to currently not be successfully engaged in outpatient treatment. They need to meet an either-or criteria of unlikely to survive safely in the community without intervention or at significant risk of relapse. CareCourt needs to be the least restrictive alternative, and there needs to be a presumption that they would benefit from the services. Thank you.
Thank you. Thank you. Any other questions? All right. Yes. Okay, Judge Clark.
Yes.
What happened to report differently than a usual case? How is it different than a report?
Well, care court is an entirely civil court proceeding, so these hearings will be happening in a courtroom that is unique to focus on care court. Those individuals will, when the petitions are first received by the court, the judge who's assigned to handle the care court caseload will be reviewing them to make sure that the applicant has met that initial prima facie showing, and then the matter will be referred over to behavioral health for the full eligibility report that will be returned to the court. And if that person is then accepted into care court, the court will be adopting that care plan for that individual. And from there, the court will be setting a series of hearings just to monitor that the services that are contemplated under that care plan are being delivered to that individual, and to assess if there are additional needs for that individual in order to afford them the best opportunity for success. The initial care plan will last for a period of 12 months, and it can be extended for an additional year from there.
Is there any compulsory angle to this as far as if they one day decide they don't want to be part of this program? Is it up to them?
Absolutely not. Care Court is an entirely voluntary program, so individuals can, that for whatever reason are brought to our attention via petition, they could choose potentially to participate in voluntary services through behavioral health outside of the care court structure. They can choose to participate in care court. They can tell us that they are not interested, in which case there's no compulsory aspect of it in any way. Thank you. A broad range of individuals, and it's really not limited. The real criteria will be a person who knows the individual or has enough information about the individual to provide that necessary background to show that they meet the criteria, to make that prima facie showing. Behavioral health will be investigating further to make sure that and gather further information on the individual. But the referrals can come from family members, they can come from friends, they can come from members of the community, caregivers, first responders, and we've tried very hard to make sure, in cooperation with the county public information officers, that information has been disseminated to as many individuals and groups as we could identify, to tell them how to reach out either to the CARES line for behavioral health or for the court self-help center for additional assistance in how to fill out those petitions. So, thank you.
Okay.
Okay. You got two of them here.
How is this going to help you? What kind of tool are you helping officials, and what will you be able to do you won't be able to do?
Well, first and foremost, it's nice to see it's not a police-related problem. Like everybody's been saying for years, it's not a police problem. But I beg to differ if it takes up half a police officer's shift, if that's what they're dealing with. So anytime we can add an additional tool to our tool chest, and we're going to take it. So we're excited about this. I can see when you were asking earlier about referrals, a lot of our teams that are out there every day who really know almost everybody in the city that's dealing with this. This is another option that they have as far as to do referrals with our public safety engagement team, which you heard about earlier. We also have our clinicians that ride with our police officers. So any additional tool is going to be welcomed by us for sure.
All right. I think that's all the time we have this morning. I want to thank everybody for coming out today, and hope for families. That's our message today. Thank you all for being here.